You're welcome. Once again, I'm Dr. Yakubu Adams, also known as Dr. Proxy. I'll be talking about pelvic inflammatory disease. Pelvic inflammatory disease is an infective and inflammatory disorder of the female upper genital tract infection. This is to also state that there are other forms of female genital tract infection. Unfortunately, pelvic inflammatory disease has been misdiagnosed and overflogged in our daily consultations and also in our seek or our quest for solution to healthcare. Now, pelvic inflammatory disease is found amongst women on average between the ages of 18 to 25, and in places where sexual practices are quite high, 15 to 25. But that's not to say that we don't have women above this age range who have pelvic inflammatory disease. Well, of course, you can have women up to the age of 40 with pelvic inflammatory disease. Now, it is sexually transmitted. It is sexually transmitted, and it is found amongst women who have multiple sexual partners or women who have intercourse with men that have multiple sexual partners. Now, how do they acquire this? I said it's sexually transmitted and it is an ascending infection. It affects the uterus, the fallopian tube, the ovaries, surrounding pelvic structures, and in severe cases, some of the structures around the liver, the perihepatic structures. Now, how do they present? What are the signs and symptoms of pelvic inflammatory disease? The first is pain. Pain ranges from lower abdominal pain, lower back pain, waist pain, pelvic pain. Also, women can also experience pain during sexual intercourse, which is known as dyspareunia. Another symptom is there could be irregular menstrual flow. It either flows scanty or more than the usual, or a woman can have a number of bleed, intermenstrual bleeding, and all that. These are all symptoms of pelvic inflammatory disease. Also, women who have pelvic inflammatory disease can also experience severe menstrual pain, dysmenorrhea. They could have experienced severe menstrual pain. Vaginal discharge is another symptom, which could be very foul smelling. Some women could present with fever. Some women could also present with body weakness. Now, as part of the complication of pelvic inflammatory disease, some women or some ladies could also have complications of infertility as a result of tubal blockage. These are all symptoms of pelvic inflammatory disease. Now, when you come to the hospital, the doctor examines you. One of the things that points towards pelvic inflammatory disease is during vaginal examination. He elicits what is called cervical motion tenderness. He tries to push the cervix to the side, and pain is elicited. This is one of also the signs of pelvic inflammatory disease in a clinical setting. Now, it is worthy of note that ultrasound scan alone is not specific, is not diagnostic of pelvic inflammatory disease. There are other investigations that could be carried out, especially in low resource centers where we don't really have much. Endocervical swab is advised. In the cervical swab, sample is taken from your cervix. You take sample of the discharge, and culture is done, and then you check the sensitivity to see which antibiotic the organism is susceptible to. Now, it is also worthy of note that the identified organisms that have been recognized to be consistent with pelvic inflammatory disease in most cases is Chlamydia trachomatis and Neisseria gonorrhoeae. These are the two agents that are responsible for pelvic inflammatory disease. However, not to say that there are not a number of other agents, but these two are the mostly recognized from studies that have been carried out. Now, I would also want to talk about the complications of pelvic inflammatory disease. Complications, I've already made mention of infertility as one of them. Ectopic pregnancy is another complication. And in very severe cases, the infection can ascend into the pelvis and there will be collection of abscess, and it can also get to the surrounding liver structures in a condition that is known as the Fisz-Kohat's syndrome, which leads to what is known as a frozen pelvis. Now, what are the treatments? The treatment, empirical antibiotic treatment therapy is advised by Center for Disease Control, but we do not encourage patients to do self-medication, to buy over-the-counter antibiotic medication. So we advise that you see a doctor in a hospital so that a proper test is carried out and to see which organism is susceptible to the antibiotic that is susceptible to as well. And in severe cases, treatment as a result of complication, surgical treatment can be carried out, to drain out the collected abscess, the pus that is collected in the pelvic region. So, and adhesiolysis in tubal blockage and other complications that will arise from pelvic inflammatory disease, which of course will be surgical. So it is advised that you see the doctor for proper counseling and for proper treatment. Now, that is to tell you that pelvic inflammatory disease is not the only female genital tract infection in the hospital. I hope this video has been of good help for you. Now, for patients who have pelvic inflammatory disease, we also advise that they get screened for other sexually transmitted infections like syphilis, HIV, just to rule out the possibility of having co-infections. That's the end of my presentation. I hope this video has been helpful. Subsequently, I'll be talking about vulvovaginal candidiasis, and I'll also be explaining why toilet infection is not specifically mentioned in medical context. So, like, comment, ask questions, and don't forget to subscribe if you have not subscribed. Thank you once again. I'm Dr. Adams Yakubu. I will be waiting to see your comments and your questions. I would reply them as promptly as possible. Bye.